Metropolitan Health Department. And of course, Ms. Lester, before we had our break, Ms. McClellan was explaining to us the pain that is generally associated with sickle cell diseases. And let me sort of shift the emphasis during this last period to talk about what might be considered sexually transmitted diseases, which would give you an opportunity to talk about AIDS, HIV, and some of the other problems, and then we'll have Ms. McClellan to help us wrap it up for today. Let's talk about some of these diseases and what the Metropolitan Hospital, Metropolitan Health Department is doing in terms of trying to meet the needs that we have in the community.
You've mentioned STDs and HIV/AIDS. Those are, all of them are sexually transmitted diseases. Some of the ones that are not commonly talked about, especially on television, is chlamydia, gonorrhea, and syphilis. Syphilis has been nationwide decreasing, but we're finding in Nashville that that's not the case. And so the health department is looking at ways to get the information out into the community about the rising numbers of syphilis in our community.
There's an increase, you're saying?
It is increasing. And you've led me to go into some plans that we have about the community. We're looking at, our data is being pulled together as to what age group it's rising in, what sex it's rising in, and what race it's rising in. And we're finding from preliminary data, all of this is to be finalized, that our younger people are now getting syphilis. Syphilis used to be a disease of middle age, about 20 to 30 years of age, and now we're finding it in our 15-year-olds and 16-year-olds. So we have to get a message out there to our young people about how to protect themselves from the sexually transmitted diseases. And one thing for women and for young ladies, more than 50% of them don't have any type of symptoms at all until it's to a point where they have some real damage to their system. And so we are working on a community plan to make the community more aware of where the problems are and how to deal with it. There is a rise, of course, in gonorrhea and chlamydia, but those are diseases that do have symptoms more so, especially in the men. And once the men present to the clinic or their physician to get treatment, the first thing is asked is their contacts. And so we're able to get more people in for those type of sexually transmitted diseases. HIV/AIDS is, of course, a disease that a cure has not been found. So it's very important that if our young people are not abstaining from sexual actions, then they need to know how to protect themselves. And they need to know where to go to be tested, to see if they have a disease, and